Western Spring Television. Ours it is.
Good afternoon, viewers at home, and you're welcome to Spring Clinic, where we diagnose and treat all manner of ailments and diseases every week on television. Today we are here again with another expert in the house, at the clinic, to do justice to the topic we are about to discuss. Let me say we want to apologize sincerely for starting this program a bit behind schedule. It was due to exigencies of duty in the clinic. But our consultant is here, and we are treating something that is very important today. We are looking at psychiatry, or you call it mental health issues. She's a consultant psychiatrist at Uniosun Teaching Hospital here in Osogbo. It's my pleasure to welcome to the program, and of course to the clinic, Dr. ADEFILA Oduyebo. You're welcome, ma.
Thank you very much. Good afternoon.
So good to see you.
It's nice to be here.
Thank you very much.
Yes, sir.
Was the clinic very busy today? That's why you came in.
Yes, it was.
It's a clinic there, I want to presume.
Yes.
Okay. Now, let me start by asking this question. You call it psychiatry.
Yes.
Laymen we call it mental health issues.
Yes, sir.
Can you break it down for us? At what point do you say that there's a mental health issue in a particular patient or psychiatric related issue?
Okay, thank you very much. Mental health is very important, and it's always said when the definition of health is defined, health is defined as a state of physical, mental, and social well-being. And so a person is not said to be well if it's mentally, if there's something wrong with the mental health. And so it's always said that there is no health without mental health. And we all know that the faculty where issues about the mental health is concerned is what really controls everything that has to do with us and behavior. And so it's important that one understands what mental health is. And so what is mental health itself? Mental health is said to be the capacity of an individual to be able to realize his or her potential. That's when you're able to know this is what I can do, this is what I can't do. He is able to cope with the normal stresses of life.
Okay.
You know, that means life comes with stress that can be said to be normal, and the individual can cope. That means everybody who is mentally well should be able to cope. And then he's able to adapt with certain situations, adapt to certain situations. That means there are situations that come and the person is able to cope with it. And then the person must also be said to be fruitful and productive in his community. Okay. So once there's a problem with fruitfulness and productivity, there's something wrong with the mental health.
To a layman, when you say, I'm going to visit my psychiatrist friend, they question your mental state and they ask you, is there anything wrong with you? When the word mad and mental health state, how do you juxtapose that?
Okay. You know, the normal thing is that when people think about mental health, they think about the fact that the disheveled man, the picture of the disheveled man on the road is what many people think about. And so once you say you want to go and say psychiatrist, they're like, what is wrong with you?
Yes.
You know, I still remember a young man who was a staff at the time, who was still a staff and all that, came in and had one or two complaints here and there. And so we said, this is anxiety. And immediately we referred him to the mental health clinic. He said, doctor, I'm not going. That if I go there, people are going to be saying, that means in that means everybody thinks that the mentally ill person is a psychotic patient.
Okay.
You know, and the psychotic patient that has no control completely and nobody is actually taking care of the person, because there are psychotic patients that have assistance here and there, and people are able to lead them right to the right places and what to do. So that makes people naturally want to stigmatize the mental health physician or visit to the mental health clinic. But it has caused a lot of harm.
So are you saying that a person with a mental health challenge or psychiatric challenge is not necessarily a psychotic patient?
Yes, it's not necessarily a psychotic patient. There are so many types of mental health problems. You know, many times when our patients come, you have to keep explaining to them that if you go to somebody who, the orthopedics, for example, you go to a surgery clinic, surgical clinic, and you complain about your leg.
That's right.
It does not mean that there is a cancer in the limb already. But many people go to what they call the extremes. But there are some other subtle mental health issues that don't seem extreme, but may end up with a lot of trouble in the long run. And that's why you'll find that at times people may have depressed people around them and they don't know because they are not, in quotes, psychotic, or they are making no noise. In fact, they may even see them as just being quiet. And many times people want to exchange the normal sadness for a depressed person. You know, you see somebody who has just kept to self and all that.
I was about to ask that question. When you see people who are withdrawn,
yes, sir,
who are not communicative, who are just in their own world,
yes, sir,
and they say they are depressed or is in something syndrome. I can't put my finger on it now. Is that a time to watch out for a psychiatric challenge or mental health related challenge?
Yeah, there are different reasons where people are withdrawn. And so withdrawal to self does not mean the person is depressed, but the person may be. That may be one of the symptoms the person expresses himself with. But when if you are living with somebody, you've watched somebody for a while, and you suddenly see a difference in the person's behavior, it's important to go close to the person and find out. And then once you find out that it has to do with a mental health issue, the wisdom is to help them come and see a mental health physician. You know, I still remember a young man, a young student of 400 level in one of our universities a few years ago. And it was only after he committed suicide that the neighbor said, "Oh, I noticed that I gave him food and actually we collected, but he refused." Wow. You know, so she saw subtle symptoms that show that this person is withdrawn, but she probably just felt maybe he just wants to keep to himself. And so it's important that we are sure that this person really just wants to have a change or something and just wants to. And anybody that keeps to self and is not the person's personality, it's only going to be a short time.
That's something to interrogate.
It's going to be a short time.
Okay.
If it's just that the person chooses to maybe malice or something. Okay. But if this person consistently does that,
it becomes a permanent feature.
And becomes, yes, it's important that whoever is closest to the person, including parents.
How do we, with due respect, how do we notice this psychosocial analysis? I mean, or behavioral pattern in human. How do we notice that? We can't have Dr. Duyoye or Yebo.
Yes.
Many of you everywhere.
Yes,
I mean, you are the expert. We are not experts.
Yes,
Dr. Duyebo will see you and know that, oh, this guy is depressed. He needs to see a doctor. But laymen, how do we do psychosocial analysis of people, our relations, so that we can escalate it to professionals like you?
Okay. When you live with people and you see a behavioral change, for example, let me use depression, for example. This person suddenly has become very sad. Sometimes some of them keep weeping and crying, and they really can't, and you ask them why. They say, "I don't know, I just crying," you know. And you see things like that, or you find out that this person who naturally will wake up, go do house chores, just feels like not getting up again from bed. I just dealt with somebody not too long ago, and he had been coming in and out of that mood for the last 3 years, and nobody took him to see a mental health physician until just of recent, because they are unaware that when people who used to be energetic, people who will naturally want to go to their workplace, suddenly says, "I don't feel like going." They began to lose interest in pleasurable activities. Some that love to watch television, love to watch ball, begin to lose interest in their desire for such things. You begin to suspect that something is wrong somewhere. Some of them, I see, we have patients who have come and said, "I will concentrate well at work, but I find that now I can't concentrate anymore. I try to, but I can't." Some already begin to have feelings of guilt, and maybe they write to people on offenses they really never committed. And that's why in the past, so many depressed patients have been killed and are called witches on the basis of the fact that at that time, they probably have what we call a delusion of guilt, and they began to blame themselves for things they never did. There are some that maybe their parents died some time ago, but suddenly when they fall sick, in that context, they begin to feel that they were the reasons why their parents died.
Dr. Duyebo, we are going through a dire strait as a nation.
Yes, sir.
The economic indices are not smiling. Nigerians are finding it difficult to cope.
Yes, sir.
That means there will be an increase in the number of depressed people.
Right.
But how do we notice the red flag when we are going to cross the line? And what are the things we are going to see? I know you've mentioned some of them.
Yes.
We are going to see that, oh, this thing, the handshake is going beyond the elbow, and we need to escalate it to a professional.
Yes. With the situation around the fuel subsidy removal, the fact that everybody used to buy fuel at less than 200, and now you're going beyond. And you know, by the time we even said 500, everybody was like, oh, before you knew it, all the filling stations started increasing, I put it 10 naira, 20 naira, 30 naira.
Beyond
yes.
what we can cope with.
Yes, and so for so many people are asking themselves, how do I cope now? And for some, they may find it difficult. That's what we call the inability to cope with the normal stresses of life. In this same situation where the fuel crisis is, you'll be shocked that some will get better and things will even get better. Other ideas starts coming on how to make ends meet. And if you look at it, this fuel subsidy removal was even the reason for their success. But for some, it will be so difficult, and they begin to see the world, they begin to see themselves, they begin to see their environment, and they begin to see their future on a negative note. That's what Aaron Beck calls, you know, has the distorted way, the cognitive distortion in which people begin to see life. And so once people begin to see life that way, see the negative view of themselves, negative view of their future, negative view of the environment around them, some of them may break down. Not only depression, there are many other kind of illnesses that can come. Some may even get completely psychotic because they will begin to find it difficult to cope with that situation.
Dr. Biyabo, I'm sorry to boat in.
Yes,
we'll go on a short break now. When we come back, I'm going to interrogate the issue of marital reason. Is it a major reason why we have depression amongst the female gender? Or is it drug a major reason why we have mental related issues among the male gender? My guest is Dr. Adeola Uduyebo, a consultant psychiatrist at University Teaching Hospital, Osogbo. And the topic we are discussing is mental health issues. Call it psychiatry. Don't go anywhere. We'll come back in a short while.
Iconic African presents the narrative of a man destined to exert an imperishable global influence in Western education. His was a story of a freeborn, captured and sold into slavery. He was born in Osogbo, a native Yoruba village near Iseyin in Okeogun axis of southwest Nigeria. Samuel Ajayi Crowther was the foundation student of Fora Bay College, Sierra Leone, the foremost university where the pioneer set of native Africans were educated. Samuel Ajayi Crowther's greatest contribution to humanity was his translation of the Holy Bible into the Yoruba language. The man who authored the Yoruba dictionary was also credited with the translation of English classic hymns into Yoruba and the Ekwere languages. Samuel Ajayi Crowther's private residence in Badagry, incidentally the first story building in Nigeria, is an Akava museum dedicated to the memory of Africa's first bishop. Western Spring Television identifies Samuel Ajayi Crowther as a watershed character in history.
Welcome to Spring Clinic. My guest is still very much in the house, Dr. Adeola Uduyebo. Madam, you're welcome.
Thank you, sir.
Yes, I was asking before we went on break that can we say that mental health issues are more prevalent among the female gender than the male gender?
I think it depends on the mental health issue. We have some kind of mental health issues that we call the internalizing one, in which you like anxiety, depression, that you find a lot more among women, the female gender. Even when you have to talk about children, you still find it more among the female gender than the male gender. And then you have some that we call it the externalizing, in which you have more among the male gender. That has to do with antisocial personality disorder, conduct problems, those other issues in which the person hyperactivity and all that. You find it more among the male gender.
What triggers internalizing and externalizing ones?
It's said that because of the way women were created, they are more sensitive, more emotional. So they tend to internalize their issues more. So the tendencies for problems that have to do with emotional issues,
like marital challenges, children-related challenges, family-related challenges.
All of those problems can cause any type of mental illness. Of course, there are also mental illness in which you find the same prevalence in the two, even psychoses, obsessive-compulsive disorders, some kind of phobias. You find it.
What role does drug abuse play in this prevalence scenario you are painting?
It's as far as substance use disorders are concerned, it's more among the male, even though now the females are really catching up. And I think it's...
They're beating them in their game.
Yes. Females always come that way.
I know. I'm better at it.
So you find that when in the male gender have issues, instead of discussing it, because they are not more, the female have better, they are more verbal as far as their ability is concerned than the male. The male is more, they are more visual, spatial, what they see, and they are reasoning and all that. So they tend towards other ways to suppress what it is. So many times they go into substance use. So you have more of them going to substance use for that purpose. And then because of some other issues, social issues, the male gender wants to toast the girl. That's talking about young people. And so some of the young ones have gotten into substance use. Especially they seem to have some subtle personality problems, anxieties here and there. They just look for how to solve it.
That's right.
Meanwhile, there is said to be that we may not be able to exactly say where. It's that those ones are suppressing it. And then they don't come and say it. The female naturally will want to go to the hospital and explain and complain. The female will want to call
men for
somebody.
macho, patriarchy reasons. I can handle this. So some get into
problems. Addiction.
Now, my director and producer just whispered to my ears that nagging, is it a sign or symptom of mental health issue when somebody nags excessively? And it's very common amongst people.
Yes. Women have the verbal ability. That I always say that, at the time in church, I was talking about the female, then I said, no, don't go home and say Dr. D said we have verbal ability. That's why I talk a lot. I think that nagging is a situation in which you keep talking about a thing, or you keep pressing on, or you have not seen other ways to handle the situation, and you just think that is the way to do it. And because the female
talks, pressure the person.
Yes. So because the female talks, the male may not talk, but some of them will use their fists in expressing the same thing that a woman will do in the other way.
So that's physical abuse, verbal abuse.
Yes, verbal abuse, and it's all abuse. Only that one of them seems more dangerous than the other.
I know.
So it's important that as you learn to cope with the normal stresses of life, it will help you know exactly what to do. But there is a level of nagging that gets to a point when we say this is real verbal aggression. You understand? In which the person keeps talking and the person's personality has actually changed. And, initially somebody may say, I just thought, because there are many people like that the person had broken down and had mental illness, and they just thought that it's a until they got to certain extremes. For example, some that get to a point, some women that get to a point of now doing real physical abuse, they have subtly expressed some level of verbal aggression that was
not listened to. That's right. Now, we've noticed that mental health-related issues are now becoming a thing of concern among the youngsters, among the young ones. And they tend to indulge their pleasure plays through abuse of drugs and something like that. Have you noticed this as a source for worry in your list of patients?
Yes, it's actually becoming a real source of worry, such that even our center now, we're thinking about having a drug ward.
Wow.
You know, with those days, everybody stays together, but the number of patients, the young people that have gotten involved in use of psychoactive substances and now affecting their minds is getting on the increase. And so it's important that we begin to see how to curb it. Do you know the globalization thing is also an issue? You don't need now, those days, it will take a neighbor to smoke or an uncle somewhere smoking. For a child to notice or to see. That's now right. You even see people advertise it on Facebook. There was a time I saw a set of females. Okay. And the video went viral. You know, each of them were like, okay, what can I smoke? And everybody was just smoking. And, you know, somebody looks at that and just feels that this looks like it. Then some of the quote, the role models that some of the young ones have are also involved in substance use. And so it's easy for children, because the child age still ends at 17.
Doc, I wish I can keep you for much longer, but my producer is whispering something in my ears. Now, let me tell you this. We've spoken about the problems. What advocacy methodology or strategy can we deploy to stem the tide of mental health issues in our society? Because it's becoming a real problem.
Yes. It's important that people are educated, and I want to thank God for you and this organization for making all this available.
Thank you.
Because those days, when people think about a psychiatrist, they just don't think there are people they want to listen to, except they have a disheveled person around them, which they will even prefer to do in the hiding. But, you know, but so education, people getting enlightened, people through radio, through television, and then also the medical personnel being ready to make themselves available to educate, including secondary school. You know, we're also having a number of them there, and so it's important that there is enough enlightenment. And then it's all now important that that enlightenment should help people know who to refer these people to. And then as many as are in the clinics, that's why we don't like to walk away from them. Incidentally, our own field is such that even during strikes that is not everybody on, we still tell our patients to come so that we give them prescriptions and all that, you know, because we need to take care of them. So the capacity to be able to easily diagnose these ones and take care of them, it's also very important. Then the government needs to do a lot of these things. We need to do a lot in also stemming down the stigmatization for patients like that.
I was coming to that as we round up. You see, when we drive through our cities, our villages, hinterlands, and city centers, you see a lot of people that we tag as mad men. A friend of mine told me once that most of these people can still be rescued if government does the necessary or their family didn't cast them away. Is that true?
That's very true. In fact, to an extent, one of the former governors tried to do what they call the whole rehab and picked up some of those disheveled people on the roads and brought them for treatment.
So people that look so tattered in rags, with overgrown hair, they can be rescued and restored and redeemed. But
they may not, some of them may not go back to their pre-morbid state because it's become chronic. It's just like saying that, okay, somebody had a little burns on the leg, okay, it's treated, and by the time the person is out of it, he walks out. Or somebody has a little burns, is not treated, and the thing gets really bad.
But how do they get on the street in the first instance? Ab initio, let's interrogate that.
Yes, there are so many symptoms that many of them may have that make them walk away from home. Okay. Some of them may hear strange voices that say, go out. And some of them will hear those voices that say go out, and they keep going. We still had a patient that we admitted, was it this year or last year? The relation said they had looked for him for years. He walked out of the place. I still remember talking to somebody not too long ago, and it was said that the boy said was said to have walked out of his hostel room and went somewhere. He took the fact that some people got to, somehow God had his ways of getting him back. If not, he could have walked down. So some of them walked from one town to the other, relations looking for them, and they never find them.
Doc, I think I have to bring you back. Mental health issue and psychiatry, as you have discussed it too brilliantly, is very important for the survival of a nation. So 45 minutes is not enough for us to do proper diagnosis of this issue. I want to thank you for coming on the program.
Thank you so much.
It's a pleasure to have you.
Sir.
Thank you very much.
Yes, sir.
Guest, viewers, my guest has been Dr. Adeola Oduyebo, consultant psychiatrist at Uni Ocean Teaching Hospital in Osogbo, and we discussed mental health-related issues on Spring Clinic today. Until next week, when we bring another qualified consultant or medical personnel on Spring Clinic. My name is FEMI ADEFILA saying, see you next week. Thank you.